I'd like to welcome back Dr. Brenda LaTowsky from the Don't record that, please. Hi, everyone. Welcome back to the Radiance Revealed podcast, and I'm your host, Dr. Jen Haley. And today on the podcast, I welcome back for the third time Dr. Brenda LaTowsky. She is a board certified dermatologist and she practices medically, but she is the cosmetic expert I like to go to talk about all the latest and greatest. And today, Brenda and I are going to talk about the newest cellulite treatments. We've talked about eye treatments in the past, and we've also talked about Botox and fillers if you want to look back into those older podcasts with Brenda. But today we're going to talk about cellulite. So stand by and enjoy. Hi, everyone. Welcome back to the Radiance Revealed podcast. I'm your host, Dr. Jen Haley. And today I have on the show Dr. Brenda LaTowsky. She's a really good friend and a colleague of mine. And she's been on the show twice before, once talking all about eyes, all the issues you may have with your eyes and what to do about them. And another time we did a primer on Botox and other neuromodulators and fillers. So Brenda is a board certified dermatologist. I've known her for a number of years. She's my go-to person for cosmetic insight into the newest in the industry. And Dr. LaTowsky has a clinical practice here in Scottsdale, Arizona, and she does a large number of studies. Most recently, she was a major center for some of the studies on cellulite. So that's what we're going to talk about today. So I hope you enjoy it. And if you do, please subscribe, write a written review, and share it with your friends. Thanks so much. Enjoy. So welcome back to the show, Brenda. I'm so glad to have you here again.
Thank you so much, Jen. I'm super happy to be here. Thank you.
Yeah. So, I get a lot of questions on cellulite. It's always an important topic, especially in the summertime, but in Arizona, it's kind of always an important time. And
Absolutely.
I know you were involved in a lot of the research studies and you're always on the cutting edge with the center that you have doing all of this research. So I said, who is better to discuss this with than Dr. Brenda LaTowsky? So before we jump in onto some of the treatments though, like what even causes cellulite and why do we see it more in women than in men?
Yeah. Well, first of all, thank you so much for the kind words. I also have personal experience with cellulite. So I can say from firsthand experience, it can be very bothersome. But to your point, cellulite is more common in women than men. They say about 90% ballpark of women will have cellulite, whereas about 10% of men have cellulite. And that's due to genetic differences. So the cellulite is caused by these fibrous bands in the skin that pull down on the skin and lead to that textured, dimple-like appearance, orange peel appearance that can drive us crazy. And so the treatments out there, especially the most recent treatments, have really focused on that fibrous band pulling down on the skin and therefore targeting the dimples of the cellulite.
Okay, so just so I understand correctly, so we have these little bands of connective tissue, almost like a checkerboard pattern underneath the skin. And in between those bands is where like the fat pooches out, and that's what gives the appearance of cellulite?
Yes, that's exactly right. So the bands are pulling down and it's making a textural difference in the skin. So the skin's not laying nice and flat like we want it to. It makes it a little bit dimply and poochy, like you said.
And why do we see it more in women? And then why more on like the thighs and the buttocks? Is it just because those areas have more fat, or is it because of something else?
Well, they don't really know, to be honest. The difference between men and women probably is hormonal, but I don't think anyone's really elucidated that exactly. And then one thing that kind of contributes to the appearance of cellulite is lax skin. So a lot of people feel like their cellulite gets worse over time. and that can be accentuated on the buttocks and the thighs. When in reality, the skin getting loose and kind of saggy will accentuate the appearance of cellulite, but it's not actually contributing it to it, because the loose skin has nothing to do with the bands pulling down and making those textural differences. But I think we perceive it on the buttocks and the cellulite or in the thighs more because we also might have some loose skin going on there.
Okay, that makes really good sense. And I feel like there's certain times a day where cellulite looks worse. Like at noon, I feel like every single person has cellulite at the high sun. Like lighting really
That
makes a
could
difference.
Lighting makes a difference. Yeah, our hydration makes a difference. So a lot of previous cellulite treatments were more temporary in nature, and a lot of those treatments centered around hydrating the skin or creating a little bit of swelling in the skin that can make the skin look more hydrated and therefore lessening the cellulite appearance. But to your point, those treatments tend to be temporary. So
Mm.
that's actually a really, really good point.
Okay. And what about like lymphatic massage to help remove? Is there any association with toxins that build up between the fibrous strands, or do you think there's not enough science behind that?
I haven't really seen a lot of objective data. It makes sense. I think it'd be something definitely worth looking into now that we have these major treatments that target the fibrous bands. Now we can start being a little pickier with our treatment and say, okay, we know how to treat these bands. Now what's the next step there? But I don't really know of anything that has large randomized controlled trials testing the toxins or anything like that, but I suspect that they probably play a role.
Right. And it just makes sense too. I mean, we've seen this over the years in treating thousands of patients, right? Everyone always does better with even the most effective treatments if they're living a healthy lifestyle and removing toxins and enhancing blood flow and improving lymphatic drainage and exercise and just flowing flowing through the body to deliver nutrients and removing toxins. So what you're saying with
Yeah.
the other treatments that we've had in the past, they don't necessarily remove the cellulite, yet they make the appearance look better, almost like we can't really reduce pore size, yet if we clean out the pores, we can make pores look smaller. Is that what you're saying with the previous treatments before we jump into the latest and greatest?
Yes, yes. So kind of like that, or sometimes even you might have as you know, and as your readers might have noticed, if skin is dry, it looks a little bit more wrinkly. It doesn't quite look as healthy. We put a super hydrating moisturizer on, or if the people in the mall stop us and put something really moisturizing on our hands, the skin looks better, right? And so it's kind of that same concept where you're doing something to the skin, the something causes it to look better, but it's not necessarily a long-term change in the skin to create those
Okay.
long-term solutions.
That makes sense. Okay. So hydration from the inside out and the outside in will basically make the discrepancy between the bands and the fat pooches less obvious, but it doesn't
Yes.
necessarily make them better. Okay. Okay. So that's really interesting. And as far as some of the treatments, let's jump into that. So just line it up.
Sure. Yeah. So, one of the first treatments for the band is actually a treatment called Selfina. And this is not new. This has been out for several years. It's FDA cleared. And it actually uses basically manual labor to break up the bands. So basically, a little blade is placed underneath the skin and breaks up the bands, and it creates a lot of bruising and swelling, and the patient has to have a lot of numbing injected into them to tolerate it, because again, it's just manual labor going on underneath the skin. I do not do that treatment, so I don't have extensive knowledge on that treatment, but that treatment is specifically for the bands and for the dimples. So the dimples have a band underneath them pulling down. And
So is
so,
is it almost like subcision, like we do for acne scars, where you go under the
yes,
skin and just sort of try to break up that
in fact,
band?
that's exactly what it is. Yeah, it's manual
Okay.
subcision. Yes.
Okay.
So I've heard good and bad feedback on it, and but that is kind of the first treatment out there that has really been a long-term solution for the bands. So that's where we started with. Now, in the last year or so, there have been two new treatments that are really exciting for the treatment of cellulite, the bands, and possibly even some skin tightening along with it. I say possibly because the skin tightening is probably the most exciting. However, it's very difficult to study that, and that was specifically studied in the studies. So the companies aren't really allowed to say they do skin tightening, and it wasn't objectively measured in the studies. So one of these treatments is called QWO, which is a collagenase. So it's an enzyme that breaks down a certain type of collagen. So it breaks down the collagen, which is making up the band, and therefore the band loosens or even goes away.
And how is it performed? Yeah.
So that is an injection. So it comes in a little vial, kind of looks like Botox or something similar. So it comes a little vial, you pull up the liquid, and then prior to that, the patient is marked out. So we mark the little dimples, and then we inject each dimple several times. So we inject straight in, we inject at an upward 45-degree angle, we inject at a downward 45-degree angle. Afterwards, and this, by the way, is not painful at all for the patient. So a lot of times doing injections, things we ask ourselves, is this going to burn for the patient? How uncomfortable is this? This is a lot of injections for a patient. So it's a lot of, it's a lot of question about patient comfort too, because this is an elective procedure, and this is surprisingly not painful for the patient. Afterwards, we apply pressure for about 10 minutes, theoretically holding the QWO kind of in place and letting it do its work. And then afterwards, the patient gets really noticeable bruising. So everybody gets bruising initially, and then with each subsequent treatment, there's less and less bruising. That's because the collagenase will also get not the main arteries, but it's going to get the little teeny tiny venules, which aren't really needed for anything useful in the skin. So little teeny tiny veins, in other words, and it will make those leaky, which causes the bruising.
Okay.
Patients feel kind of sore, like they have a bruise for 3 to 5 days afterwards. But there are no real restrictions. They can exercise, etc.
Wow, that's great. And then how many treatments do they typically need to get, and how far apart? And then what kind of results do you anticipate and expect on average? I know it's going to vary a lot from person to person.
It does. So in the study, they did 3 treatments spaced 1 month apart. And that was the end of the study. They saw great results after that. In practice, I've done even less than that. I've done 1 treatment for patients. I've done 2 treatments for patients, with them being very pleased afterwards. So I would say typically for an area, so that treats approximately 20 dimples. So each treatment treats approximately 20 dimples. You do it 1 to 3 times, and then you can go on and treat another area.
Okay.
I would say
I can't
that's
say
average.
I want my dimples counted. Okay. So, and then
and some
after,
people don't have 20 dimples, right? And
right?
so
Yeah.
you're not locked to that many injections, or you don't have to have 20 dimples to have this treatment. It's extremely customizable.
Okay. That's really neat. And then when do they notice the results? Like after 1 month after the first treatment, or a few weeks, or does it take, a few months afterwards?
Usually about a month afterwards, we can see the difference already.
Okay. So a good time to start planning to do it now if you want to be ready for the bathing suit season,
Yes.
really, right? Okay.
Yes. And because of the bruising, so the main thing I think to talk about is the bruising here, because it is quite extensive bruising. So because of the bruising, one probably wouldn't want to do it during the summer if you're out in the pool a lot, or have a bathing suit, or wear bathing suits. the bruising can take 1 to 2 weeks to go away.
Mhm.
And it can also sometimes leave a little staining. So, depending on how extensive the bruising is, how much circulation they have in the area, and what their skin type is. In other words, how light or how dark their skin type is. The lighter the skin, the less staining there tends to be. The darker the skin, the more the chance of staining. And we know that from other treatments too. Um, the same goes for this treatment. So the main thing to think about with this treatment is not whether or not it works, because it absolutely does work, but if someone wants to put up with the bruising and the staining,
And the risk of
but
having the staining,
the
which can
staining.
take like 9 months to resolve or longer.
Yes, correct,
Mhm.
correct.
Yeah.
Which is rare. Most of the time, the staining will resolve, 2 to 4 weeks, but it could be up to 9 months, especially with darker skin types. So,
Yeah. I mean, I look
it's
fair, but like because I'm Spanish, whenever like you freeze, with liquid nitrogen or we do anything, I always have brown areas for almost 6 months. So it's just good for people to be aware of that.
absolutely, absolutely. So, but otherwise, it's a really great treatment. It's quick, it's easy, it doesn't really hurt the patients, it's effective. So, the bruising is the main thing to keep in mind.
Are there any people that can't get this treatment? Like I assume if you're pregnant, you're not going to be doing this, but who else?
Pregnant, breastfeeding, I probably wouldn't treat a skin type that's 4 or 5 or 6
Okay.
because of the bruising and the staining.
So dark skin of
Um,
color.
yes, yes. So Hispanic patients, African American patients, I'm probably going to be talking about another treatment to you versus versus this treatment, because I don't want those patients to have to suffer with the staining for a long period of time.
Okay. That's really good to know. Um, okay. And then,
One other thing
yeah.
about that, the other thing to really keep into consideration is a point I talked on earlier. So a lot of patients come in and they're pointing to their thighs and they say, treat the cellulite on my thighs. But one test is to take the skin and lift up a little bit. And if you lift it up and the cellulite goes away, that's not true cellulite. That's skin laxity. That's making the skin look a little bit dimpled or uneven. And that is probably not going to give us really great results, because that's not the true septae pulling down on the skin.
Okay. And when you mean pulling up, do you mean pulling up away from the knee, like away from gravity, or do you mean pulling up away from the bones?
Pulling upward towards the little crease there. Yes. So pulling away from the knee.
Oh, okay. That's really, really good. So, do you find that in cases of skin laxity, do you have other treatments that address skin laxity, or do you consider talking to these patients about obviously lifestyle and things that can help with skin laxity, like avoiding breakdown from UV radiation, or maybe doing some weight bearing exercises and some muscle training in the gym to help improve the girth of the area in a healthy way? Do you consider that?
Yes. Yes, absolutely. Absolutely. Because most patients aren't really going to want surgery there. There might be some who do, but the majority of patients don't really want a thigh lift or a butt lift, that will create lots of scarring and downtime. So, yeah, I mean, really the only effective thing right now is some diet and exercise for that, and, environmental exposure.
Okay, that's beautiful. Okay, so that's the quote. And can you just spell it for everyone?
QWO.
Thank you. Okay. What are so we have the Selfina that came out first. And I
Uh-huh.
don't think it really took off because of what you were talking about with the pain and the downtime and the bruising and the swelling being so it's kind of a harsh
Correct.
procedure, but it definitely is an option out there that might work for some people.
Exactly. Exactly. So the next treatment is something called Resonic. And Resonic is owned by a company called Soliton. And Allergan, the Botox company, just bought this technology for multiple $1 million. I can't remember the number off the top of my head, but I think it was over $400 million. So it was pretty crazy. But this is an exciting technology that uses sound waves, so acoustic energy, so sound waves going into the skin. And the idea is that the sound waves travel past the soft tissue seamlessly, but when they run into fibrous tissue, the sound waves get interrupted, and then it's another form of subcision, but this time with the waves themselves. So the sound waves will break down the fibrous septae or
Wow.
any fibrous tissue, actually.
But it won't damage the collagen.
No, it doesn't damage the collagen.
Okay. That's interesting. So okay, this doesn't sound like it's painful at all.
It can be a little uncomfortable, kind of like patients describe it as kind of like a mild tingling, or like something's gone to sleep and it's waking up, like a little tingling like that, or a
Okay.
little tiny electric shock.
Okay.
Um, it's a little bit different. So the quo, it's injections, no device needed. This is a device. So it's a device and it's quite loud. I did say acoustic and I did say sound waves, so it's very loud. In fact, the operator plus the patient wear earplugs during the treatment. So it's very loud. And you take the handpiece, and again, patient is marked before time. So you mark out the little dimples, and you take the handpiece, you put it on the dimple, and it's set in X amount of time. I think it's 1 minute. And then after a minute, you move the session, and you move the handpiece, and each session takes about an hour. So it's a long treatment, it's a loud treatment, but the technology is really very cool.
Okay. It kind of sounds like, and your husband being a urologist, it sounds like what we do for kidney stones. Is it the
Yes,
same?
like a lithotripsy type
Yes.
device. It's same, I'm generalizing, but in general, same kind of concept. The sound waves, the key with this device, the sound waves are so much faster, and that's what makes them very specific for the fibrous septae, and makes them not harmful to the other tissues because they're going so quickly through the tissue.
Okay. That's so interesting because we're seeing now a lot of this acoustic technology because they're doing it with the Gaines wave and the Femi wave
Okay.
for genital health. And I bet they're
Yes.
just altering the waves to the degree to hit the target. So why would someone have Resonic versus Quo and Quo versus Resonic? How do you do patient selection?
So
I assume the
recommend
price point's a lot higher with the Resonic because it's a device.
the price point is higher because it is a device, it has a consumable. um, you would choose for sure kind of the no-brainer patients would be those patients with the darker skin types. So skin types 4, 5, or 6, or for your audience, that would be equivalent of um, Asian or Hispanic skin, African American skin. So the darker skin types, that way we don't have to worry about the bruising, therefore the staining. So it's not a laser, so we don't have to worry about skin type. So we can treat all skin types. So that's something that's really cool about this device. If patients don't want the bruising, that would be that would make the selection really easy. In the studies, now this is comparing apples to oranges because there were two different companies, two different technologies, two different studies. However, in the studies, only one treatment was done for cellulite, and results were seen after one treatment. And what was interesting about those treatments or that study was that the results seemed to get better over time. So in contrast to those earlier treatments for cellulite I talked about, initially you see a difference and then over time the results go away. With this technology, there appears to be a real change in the skin biology because the results were better over time.
Okay, wow. I mean, based on what you're saying, it sounds like the Resonic does a better job.
Well, we don't
I'm not
know,
comparing. There's no head-to-head studies
there's no
comparing
head
the
to
two.
head, although I would love
Okay.
to do one. I think that would be really interesting.
You probably will.
Maybe I will.
Yeah. Well, it's just nice to see also for those patients that, maybe have done a couple of treatments with Quo and they like the results and then they just want a little bit more. It's nice to have another option.
Yes, absolutely. Although one thing I forgot to mention, I'm glad you said that, Jen. One thing I forgot to mention with Quo, you get dramatic bruising after the first treatment, but each treatment you have less bruising, and sometimes patients don't even have bruising after the second treatment or after the third treatment, excuse me. So, if someone has had 2 treatments of Quo and they just want a little touch up, I'd probably just do the third Quo treatment for them because most of the downtime has probably already been gone,
Okay.
or been gone through already. But I kind of anticipate them being complementary to each other. So perhaps patient wants a treatment with Resonic, but because of the price point, the Resonic isn't going to treat the whole area. There might be a tiny bit left, and then we could do a quick treatment of Quo for the remaining area. Or maybe patients 95% satisfied with the treatment of Resonic, but they've got this one little dimple that's still bothering them. Be quick and easy to put a little bit of Quo in there. So I see them kind of not necessarily competing, but complementing each other.
Oh, that's really nice. We love to do that in dermatology. Patients always ask, why are there so many treatments? And there's a number of reasons for that because one treatment doesn't do everything, but also
Right.
because it's nice to have these complementary strategies because every issue is really multifactorial. So there's not one solution for every single person. So I'm
Exactly.
wondering, are these available outside the US? We have a lot of listeners outside the US. Do you know if they're available outside?
Um, that is a good question. I'm not sure. I believe the Resonic is. I know thus far before their official marketing release, they've released 16 worldwide, and I know not all
Mm.
of them are US sites. Um, and I'm not sure about Quo. I would guess Quo is probably available outside the US because usually the FDA is what kind of slows things and new technologies coming into the US. But I'm not sure.
And then I know this isn't medical advice, but just based on your expertise and your clinical experience, do you have any thoughts on how to use these technologies in other creative ways? Have you thought about that? Because you know how we love to like have a new product or a new technology, and then we don't just use it always for that indication. We try to say, can this work for another condition? Have you thought about that?
Absolutely. I mean, that's one of the fun parts of new technology and what we do in dermatology is, just thinking about the science of it and how to advance science in the field. Um, I think it's really exciting to think about what the acoustic technology could do with other organs. Well, to give you for instance, liver fibrosis, capsular encasement of breast implants, that sort of
Mm,
indication. Um, but to give you an example, I also conducted a very small 11 scar study with the Resonic device. And I treated keloids with one treatment and saw a dramatic improvement of the keloids with just one treatment. And we had follow up that was actually over a year. And it was the same thing as the cellulite. The improvement actually seemed to get better over time in contrast to some current keloid treatment methods that we have. So there are lots of indications out there, especially I think with the Resonic
you're
device.
such a mind reader. That's where I was trying to go with the keloids because they're so difficult to treat. I've seen so many over the years, and it's kind of heartbreaking because the patients are young. It's on usually on the chest or a lot with pseudofolliculitis barbae, like I'd see when I was in the Navy, where the guys get the shaving bumps or the back of the neck, or just from acne on the chest or the shoulders or the upper back. And for women, it's quite uncomfortable when you're trying to wear a cocktail dress or go out somewhere and you have this big bump. So we don't have great treatments for it. And that's really
Right.
exciting and promising that this may be able to help people finally.
It is really, really exciting. In fact, we treat patients with keloids at our office with the Resonic device, keloids, hypertrophic scars. even scars that appear to be healing normally, but they have uncomfortable symptoms with them, we'll treat them with the Resonic device. We haven't had the device that long in terms of commercial use, so I don't have a ton of follow-up patients thus far with them, but I agree with you. I think it's really exciting and it offers a really great opportunity for these patients.
That's so nice. Okay, so I have not seen any literature showing that any supplements or anything like that can help with cellulite. Have you come across any of that?
I have not.
Okay, yeah, just try to eat real and eat healthy, right?
Exactly, exactly. It's really tough to do a cellulite trial to objectively gauge if cellulite is improved or not. And I think that's really a rate limiting step when it comes to other things like supplements, lymphatic massage, because to your point, cellulite changes on a day to day, throughout the day basis. It's hard to objectively say that cellulite has for sure improved and this
Hmm.
is the amount it improves. So, the studies are a lot of work because of the photography and the patient recruitment and um, it's really tough to do these studies. So I think it would be tough um, for a supplement company to do a really objective study that would have a great power to
Hmm.
prove that it was actually effective.
Right, right. Yeah. Anything I didn't ask about cellulite that you want to point out, and anything new on the horizon that you're aware of?
Well, these treatments were just very recently cleared by the FDA, so this is pretty much the newest thing available. Um, I just want to say, if someone is out there who's really struggling with their body image because of cellulite, I highly encourage you to look into these options. In the past, I really don't feel like we had great options for cellulite, but now we have options that are really great. And as I mentioned, we may get some skin tightening from both of these treatments too. So I would highly encourage your listeners to just check out providers in your area doing these treatments. Don't rule it out because this might be something that could really help you if it's affecting your self-esteem.
Thank you. And then for anyone local in the area who wants to come and work with who I consider the best,
Thank you. Thank
are you
you.
doing, you're welcome. Are you doing any current studies, and how can people find you and schedule with you? And we'll have all these links in the show notes as well.
Thank you. Thank you so much. So, our practice is called Clear Dermatology and Aesthetic Center. It's cleardermatology.net, and we will have that link for you. Thank you for that, Jen. And our research company is called Investigate MD. And you can actually access our studies through our main website, through the Clear Dermatology website. And we have some forms on the website you can fill out if you want to be notified about studies. We do a lot of cosmetic studies, but also medical dermatology studies. And of course, we are doing both Quo and Resonic treatments in our office.
Okay, wonderful. And then on Instagram, you're at Clear Dermatology.
Yes,
Okay,
correct.
wonderful. Thank you so much again for taking the time to
Thank
be here.
you.
Really, really
Thank you.
appreciate it.
It was really fun, and I really appreciate having me.
Thanks, Brenda.
Thank you.